What is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. My name is Dr. Meghna Dasani. That hasn't changed since the last time I saw you guys. But today I have a guest that I can't believe I haven't connected with before. It's like I stalk her on social media. I look at her posts with stars in my eyes. And I always say, I want to be her when I grow up. So I am super excited to introduce Dr. Tracey Nguyen. Did I say that right? Did I say your last name?
You're
Perfect. Awesome. Look at that. I cannot wait to hear the pearls you're going to drop today. So welcome. I'm so glad you're able to make it.
Oh my gosh, I'm so glad we connected. And yeah, like you said, it's like we're like fangirls of each other already.
But that's the best way, women supporting women. I mean, it's amazing. 100%. And our community is so small. And the patients that we are here to serve are so many.
Yes.
It really, really takes a tribe, a village to help all of these patients. You are a general dentist, right? Just like I am. You still love teeth.
Yep. I always tell people it's funny because I'm a restorative dentist to the core. It's like got accredited with American Academy of Cosmetic Dentistry. I'm a scientific advice for the Coy Center. So it's like restorative dentistry is like my wheelhouse. And I tell people when it comes to airway management is comprehensive dentistry is airway management. It's no different. And I think that we almost overcomplicate it. And it's you just do dentistry, and my message has always been just don't make it worse. Just understand the anatomy, respect the anatomy, just don't make the airway worse. And if you kind of go at that route and do what you can do as a dentist, I think there's so many different facets, so many different disciplines. And what John Coyce always tells us is you're not the Coast Guard. We can't fix it all. There's so many different disciplines that affect this disease that we're both preaching about, and I think that dentists, I think there's some of us that try to do like too much that's outside of our realm, and it's like, we can only do what I always say, like, I'm a dentist. I deal with the anatomy. I just don't want to make it worse. And, and I want to help these kids grow. Like if I see them growing in a trajectory that puts them at a high risk, I want to talk about that, So I think, that's kind of like how I pretty much started. On social media, just giving that message to our colleagues and other parents.
Yeah. And that's what I tell people, you can't just separate sleep out from head, face, and neck. We work like that's our wheelhouse. You can't tell me it's like saying, I'm only going to work on bicuspids, only premolars. I don't want to work on the other teeth.
Exactly.
How does that happen? What got you started onto this?
Well, it's funny.
How did you fall into airway dentistry?
Yeah, it's like I said, I was always a restorative doc, and then what ended up happening is I kind of jumped into sleep dentistry. But what I didn't like about sleep dentistry was just the changes with oral appliances, things that I was seeing, and I know some people are like, well, it doesn't happen all the time. I was like, yeah, but it happens. And it happens enough that as a restorative doctor, I'm trained to dial in the occlusion, so I can't do something that's like, so this occlusion is okay if you have sleep problems, but it's not okay if you don't. So it was really hard for me as a restorative doctor to understand that. So I was like, I can't do it. I'm just going to be a restorative doctor. This is what I'm trained to do. I dial in the occlusion. And then what ended up happening is I met Jeff Rouse, who's a dear friend and mentor of mine now. And he was just getting his first airway cross workshop at Spear. So he just got his first course. And I listened to him. And what I loved of what he did was he put, basically the concept is it's restorative dentistry, just don't make it worse, just do dentistry. And I kind of got that, and then his story about Jake and how he saw all the signs in his kids and his son. And so what I did was I started to do my own research. So it's funny because people always ask me, where did you learn this? Where did you do that? I was like, well, I read a lot, And
yes.
So and that's why at the Coy Center, I'm their scientific advisor, because I read a lot. And so what I started to do is when I started to read the literature, there was so much dentistry in the literature, you just had to read it, and that was the thing. I was like, guys, it's in the literature. There's a lot of craniofacial risk factors. There's this. If maxillomandibular advancement can cure obstructive sleep apnea in adults, why is it so far-fetched to believe that growth and development doesn't affect this disease? And so I met the sleep physician, pediatric sleep physician in my area, and she happened to be the president of the Sleep Academy in Virginia, and we started going over cases, and I showed her like a little light wire expander, and this is when I was doing little light wire expanders on little kids. I do it differently now, on like a little 4-year-old primary dentition. And she was like, "Oh, I never saw these." And I was like, "You guys can make this?" I was like, "Yeah, we can." And it's just amazing what the medical community, what they don't know. And it's kind of like, it's up to us to educate them what we can do. I mean, because the literature is there, I mean, granted, we don't have peer reviews. Like you're never going to have an article that says, "Okay, mom, we want you to tell your child, we see your child growing in a wrong direction, but we're not going to do anything to him because we want to see how bad he's going to get." I mean, like what parents are going to put their child through that study? It's like,
I know, I'm mind blown. It's like, do I wait until they're done growing before I fix
it's
this?
just like unfortunately, the studies that we have are a lot of like case reviews. Like, this is what we're doing, this is what we're seeing. Guilleminault started his little lots of studies, and unfortunately, his studies was not massive. I mean, it was like 30 people, 40 people, but they're still studies. We can't say that they don't exist. And I get, as a big research person, I get the need that we need more data. I totally get that. But we have to read the literature and question and recognize what it says and what it doesn't say. And that's what's really important. It's like, like there are things that we should be doing while we don't have the literature supported yet. But obviously, at the end of the day, we don't want to do harm. We have, whatever we do, we have to make sure that we don't do any harm. And I think that that's the key here. Kids is so tricky because the kids, the neurocognitive consequences happen so early. If we look at Bonnick's study that looked at children, from birth to 7, I mean, she said that if you had any kind of sleep fragmentation from the first 5 years of life, you're most likely 40 to 60% special needs by the time you were 8. Well, that's before you go into the orthodont, so, and it's like the first 5 years you're in primary dentition. And that's the key there. I think that many dentists and parents and, the dental community, we have to understand is like a lot of we need to start looking at the neurocognitive consequences, not the malocclusion, and we're looking at the wrong thing. And I treat based on symptoms. But with that being said, I mean, you definitely, dentists, we can't do this alone. Interdisciplinary care is so important, like having that medical team to support you and, just holding the parent's hand,
Yeah. We'll get into team and, who or what comprises team, but I wanted to touch upon, you and I are like, we're recognizing, you quoted that study earlier, the sooner we can get in, the less damage control we have to do. Why is so much, and I don't mean all, of the dental community not seeing this, that you have access to the same articles as I do, as somebody else does? Where's the disconnect happening? What do you think?
It's the lack of research with children under the age of 6, and as dentists, we don't know how to quantify or understand neurocognitive risk factors. So like we don't have a lot of research in looking at these different malocclusions, like do we treat it, do we not, and so a lot of it, so I look at it as, okay, even if we look at the data on children that are most at risk of having sleep disordered breathing or obstructive sleep apnea, it's between 2 and 8. That's the prevalence right there, 2 and 8. So unfortunately, we don't have the research in that age group to treat, and so and I think that's why most dentists are like, well, what's the malocclusion that I'm treating? And the key here is that, and I always tell the parents, like, I'm not treating malocclusion to prevent orthodontics in the future. And that's a big misconception. And I think that's very misleading that a lot of companies do, that they say straight teeth, no wires, and it's like, I think when we treat sleep disorder breathing, or we treat this, when we co-manage this disease, we're not treating for straight teeth. Straight teeth is a nice benefit. The facial beauty is a nice benefit, but we're treating based on the signs and symptoms, and we're looking at the anatomy and saying, could this anatomy be a risk factor? Like, could this anatomy be making the child worse? So if we think about, like, let's say class 2 malocclusions, like class 2, this is the case where the lower jaw is kind of set back. Well, if we think about growth and development, the lower jaw is always lagging, so not every child child that has class 2 should be treated. And we have a lot of studies that look at dentistry, that look at this kind of bite and say, hey, the best time to treat this bite is at 12 and 14. And that dental study is right. The best time to treat that is 12 and 14. But if that lower jaw is constantly dropping back with the tongue blocking the airway, then this anatomy that's best to be treated at 11 and 12 is going to have neurocognitive consequences. And that's a decision that the parents, the dentists, and the team have to decide what risks you want to. So the orthodontic community is right in saying that, yes, we don't treat this malocclusion till the best time based on the literature. Yes, they're absolutely right. But if this malocclusion is preventing this child from keeping his mouth forward and blocking his airway, then we need to do something. So for example, like I had a child that had tonsils and adenoids taken out and is on a CPAP, and the child is 5. In the medical world, they do not care what's going to happen to the face. They do not care what that malocclusion is going to be. They just want this child to breathe. And like you think about like if a person can't breathe, you won't stop to put a trach in that throat to get them to breathe. Because at the end of the day, you want to save this life. The medical community is based on saving a life. And I respect that, and the problem is like the dental community, we're so focused on just, well, when we don't want to do it right now because teeth aren't ready. We like, if you don't do it now, you're going to do it later, and you're going to do it at kind of like at a risk. And I always tell my orthodontists, like, if we don't do anything now and we let them put a CPAP, you're going to get in there later because we know that it's retracted, so it's just a matter of when do you want to get in? Do you want to get in when the neurocognitive consequences have already happened? And that's the scary thing. I mean, Ghazal just did a really nice paper, and he said about like the risk factors of neurocognitive consequences. And he boiled it down to 3 outcomes. If you catch the disease and you fix the anatomy and the structure, and let's say you cure the disease, you have 3 possible outcomes for neurocognitive consequences. One is the child's going to be completely fine and everything's going to be normal. The child would be back to normal. So that's 100% success. Another percentage is going to have a delayed response, meaning the neurocognitive will have a delayed response to kind of get better. And then another one is no matter what you do, it's too late. And that's the challenge, is like, you just don't know. And I tell parents, like, I don't know which one you're going to fall. And that's.
But I'm going to give it a try. I'm going to give it my best to see that we get to result number 1. At least give that child the option to get there, the opportunity.
I mean, you'll never get brownie points for prevention. You get brownie points for major crazy surgeries. You don't get, because like you can't, everyone's always going to say, well, what you did wasn't it? It's just like normal growth. It's like, are you sure about that? And I'm okay. If you don't want to give me any credit for anything, that's fine. As long as
that's not why we do what we do. Yeah.
It's just like, like, I don't know. I see some of these, and it's crazy because like I see some of my kids on ADHD meds, and some of them don't get better, like even after fixing that. And that's the hardest pill to swallow. Those are the ones that I look at the literature, like those are the ones that was too late. And then I see the ones that do get better, and the ones that do get better gives me that drive to keep on doing what you do. Right. So like we do what we do because we're successful. We have good results. And that's really, really important.
Right. Yeah. And I agree with, what you said about dental malocclusion versus getting in and looking at the anatomy. I'm always telling parents, it's like buying furniture would be great, but I got to make sure that foundation isn't cracked. Can we work on this first and we'll buy our couches later? Yes, we'll get that to where it needs to be. So yes, I completely agree. Let's address that elephant in the room. We kind of touched upon it, that the news article that's doing the rounds. I know we're going to have people ask, like I've had docs reach out to me going, what are your thoughts? Yes. Parents are starting to ask questions too. So tell me, what are your thoughts about everything that's going on with the AGA appliance?
I am never one to throw anyone under the bus. And I think
we're not. We're actually presenting facts and thoughts and opinions.
And I just think that I think where this kind of goes wrong. And I see this with patients that come into my office. I see a lot of patients that are desperate to breathe, desperate for answers, to get off their CPAP, and they want anatomy to fix it. I don't think the dental where they get wrong is where they promise cures and treating. Like, I don't like the word cure. I don't like treating the root cause, because like we still don't know what the root causes of all this. We don't even know what pediatric OSA is. I mean, we can't even agree on how to score kids, and so I think it's important that like if any parent or patient starts to search for answers, it's really important that there's a whole team, like that like I'll have patients that come into my office and they'll have questions about adult experience. And the first thing I ask them is like, all right, what are we treating today? And they'll say, I want to treat my sleep apnea. I say, okay, so first of all, sleep apnea is a medical condition. And as a dentist, I can co-manage and co-diagnose the skeletal risk factors, but I need a physician on board to manage your OSA. Because we do know in adults that there's non-anatomical and anatomical factors, and that non-anatomical factors affects the expression of the disease. Same thing with children, so I think it's really unfortunate. I mean, I don't know how this treatment was discussed. I mean, in all fairness, orthodontics as a whole, like not even AGA. I mean, I've seen teeth move all over the place with just orthodontics alone, so, and Invisalign. So like, I can't comment on the specific technique. I just think that if anyone is looking for answers to their OSA or sleep disorder breathing in children or adults, it's really important to get an entire medical team together. As a dentist, I always tell my patients, like, I'm a dentist. My job as a dentist is to look at the craniofacial risk factor, look at the mouth, and just give you a nice home for your tongue, make sure the jaws are in the right place with the face. And I need a physician to manage all the non-factors. I mean, my partner, Stacey Ochoa, like there's so many non-anatomical factors right now that we're just at the tip of the iceberg. Like, I just had a patient that is on the verge of like ADHD, grinds his teeth, and so now we're looking at like restless leg syndrome, and periodic limb movement and vitamin D's. And I was like, okay. And I've had patients where I've gotten the obstructive apnea under control, but they're still having all these symptoms. So it's important that we have like an entire medical team. I do not at ASAP, and ASAP is an online comprehensive program that we have to teach dentists on airway. We don't endorse any kind of therapy, because I think like when you go straight to treatment plan, you've lost your diagnosis. I think if you have the right diagnosis, you can almost do anything. And I look at and I've retreated a lot of AGA cases. And I think a lot of times, like, and I can only say this in the cases that I've redone, the maxilla was probably too far back. And it's really, some of these cases are really surgical cases. But I get it, because I know some of my patients don't want to do surgery. So I don't know what the communication was between these patients and the dentist, or if they said, I'm absolutely not doing surgery, and so this is what I have. So, I want to be fair, because I don't know what the conversation is. But it's.
But on the other hand, if anybody promises you the silver bullet and the magic be all end all to anything, get a second, third, fifth opinion. Do your research, ask questions. That's what I tell patients. If I were to promise you a magic outcome to something, run away from me. And that's exactly what I say. So I agree. It takes a team, it takes a village to get our patients to where we need to. And we only control part of it.
Yeah, but like there's like social media platforms, like specific, like for AGA, and so and they are. I think what's happening too is that patients are coming into your office demanding certain types of treatment, and I'll say that from experience. And I mean, I've had to tell some patients. I mean, I've patients that come to office with perfectly broad arches, and they'll say, I need expansion. And I was like, but you have a really broad arch. It goes, well, I read here that I want this. And I tell them, it's like, well, you can't get that. I mean, I just had a patient the other day. I was like, he wants to be expanded, but his lower arch, there's no room and he goes, well, I'm okay if my teeth don't fit. Like, the patient said that. And so I don't know, like, it's just so, but I totally agree. It's like, I definitely think that there are advertisements, company advertisements, over promising. I mean, like I said, my trigger is like cure and root causes. I hate that, because it's like, because we can't say we cure. I mean, like, granted, I got a girl off of CPAP, but I can't say I cured her. Like I don't want to give families a false hope that you're cured for the rest of your life, because this has to be managed for the rest of your life.
As we wrap up, what are your top 3 tips that you would tell parents before they start exploring, does their child need help? What help? Or any patient? What are your top 3 tips for your patients?
So for children, the biggest thing is for parents, trust your gut. I will say that unfortunately, the education is not everybody's edging this topic. Well, I love my pediatricians, but I just don't see how they can do all the systems in the body in one visit. It's like we have a specialist for every organ, and so that if one organ isn't functioning, trust your gut. And so, I have parents that have I've had parents that have gone through 3 ENTs, and until I was like, look at these adenoids. Okay, let's get a sleep study. I had one kid that had 35 apnea events. She's like, this 9-year-old has as much as a 300-pound man, and so for parents, trust your gut. The biggest thing is the neurocognitive content. If your child is not acting right, and you see your child grasping for air, get answers. Adults, this disease is so complicated. Obviously, if you have a malocclusion that warrants dental treatment, then yes, you should get it. But just like you said, there are definitely many options claiming to treat airway and sleep, and you just really have to what your options are. That's a big one. And for dentists, people always ask me what's the best course to take. I say, if you can afford the money and the time, learn from every, people come to ASAP and they'll say, well, I've done this, I've done that. And it's like, well, that's great. But you're still hungry for more information, right? You never stop learning. And I think it's very humbling. Like I used to feel a certain way 5 years ago, and then I'm always reading something new. I was like, okay, that's a different take on. But I think it's an amazing field right now for us to be in. And the more we educate ourselves and each other, push each other, and because in dentistry we have our own little civil war right now, and it's we shouldn't. We all want to do the right thing. We shouldn't. We should really be on this. We should be doing. Yeah. So I really appreciate that you reached out to me. I was like, oh, I love her.
Oh my gosh, yes. It's never about you and I. It's about the people, the patients we serve. Absolutely. How can people get a hold of you? How do people find you? Patients, doctors, whoever's looking for more knowledge, information. How can they connect with you?
Yeah. So when I went on this mission, about years ago, I put my whole social media. Now, I don't know if that's a good or bad thing, because now I share whatever. It's like I have my love-hate relationship about putting my life on display. But I do post a lot of articles, and I try to do that. I try to educate parents and other dentists. As in dentists, unfortunately, I've kind of cut back on a lot of consulting just because I'm all over the place.
There's only so many hours in the day. Yeah.
You always get messages and you're like, look, I am really sorry. No disrespect, I can't do it. So hence why we have ASAP pathway. Most of my time really is devoted to our members, getting them, teaching them all the different tools that are out there. And then I have to have my time to do research. But if you, a lot of the articles I quote, you can just Google me. Like if you go on Facebook, Tracey and ADHD, you'll see everything I've written about ADHD. So I try now to put keywords in a lot of my posts so people can just research an article. Right? Yeah.
Well, thank you for everything that you do, not just for the dental community, but for our patients as well. It is truly, truly appreciated. For our listeners, I will have links to her bio, her website, her social media handles. Go stalk her, don't stalk her, follow her. Go get all that information, that knowledge that she has, so you can help yourself and your family sleep better. As always, share this episode. This is a good one. Lots of pearls dropped, and I will see everybody next time. Thank you, Tracey.